All right, here we are. All right, I'm going to do a little intro here. Hello, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. Each week, we will be discussing the hottest topics in veterinary medicine with the hottest veterinarians in veterinary medicine. I'm your host, Mike the Voice Monkey, a full-time professional voice talent and 26-year veteran of the veterinary industry, from kennel cleanup in high school to RVT at a specialty surgical practice. And we can't ask our vet without our vet. So joining me this week is Dr. Max Better-Wieselberg. Did I get that right? Am I close?
Wieselberg, but either way, you got it. You got it.
A native of New Orleans, Louisiana, Dr. Max has been cultivating his interest in veterinary medicine since a young age, from being read Russian children's stories by his grandmother to interning at the Israeli Wildlife Hospital to practicing at several small animal hospitals in the greater Boston area. He's thoroughly enjoyed learning about and sharing his joy of animals with others over the years. He graduated from the Tufts Cummings School of Veterinary Medicine in 2018 and has been working at the Village Veterinarian since the summer of 2020. Welcome, Doc. How are things all up there in New York?
Things are well here. Appreciate it, Mike. Thank you for hosting, and really glad to be here. It's been a crazy day in the clinic, but grateful to carve away some time this evening to chat with online viewers.
How are things up there, especially in New York where you are with COVID? You started in the midst of all this craziness last summer. How are things? Are you seeing people in the clinic yet?
Yeah, thanks for asking. Things here in New York City. I'm actually relatively recent transplant. I came from Boston this past summer. This is my first time living in the city, so kind of an interesting time to enter the Big Apple during the pandemic. But things are going. Been seeing a lot of patients. I think there's been a pretty high caseload of new pandemic puppies is the phenomenon that everyone and their mother seems to be getting a puppy or kitten, and we're seeing a lot of those. And but as far as the city goes, it feels a lot more active than things were back in Boston. But I guess I'm not really, no previous experience living in the big city. But outdoor dining is happening, and people are generally speaking wearing masks, so trying to keep safe and socially distant. But as far as actually seeing patients, they're coming into our hospital, but the owners are not. So we're doing curbside drop off, and that's kind of been our policy, at least since I've arrived.
Okay. So before we get into our topic tonight, which is horrible and disgusting, it's Parvo for everybody who wants to know. Tell us about yourself. Tell me about the Israeli Wildlife Hospital. I mean, that sounds amazing. Tell us your background. Let's get to know you and
absolutely
your expertise.
Thanks for asking, Mike. Well, like you, I actually kind of started in high school. I was just, in my local veterinary hospital called Chateau Veterinary Hospital in Kenner, Louisiana, from the South. I was working as a kennel tech, just, doing a couple days a week, scrubbing the cages, taking selfies with the dogs, and to some degree, I still am doing that for cute patients. But yeah, that's kind of where that's where we brought our family dog growing up, who was a Westie named Phoebe, who I got when I was in first grade as a Hanukkah present. And I've just, been in love with animals since a very young age. And so it was kind of nice to foster my initial love for animals in that kind of medical capacity. So that was cool. Got to see a lot of stuff, and decided to take my talents to vet school. And for a while I really wanted to do wildlife medicine and just work with a bunch of different species. And so I spent a summer in college before starting vet school at the Israeli Wildlife Hospital in Ramat Gan, outside of Tel Aviv, and it was really cool. It was, kind of like on the grounds of this big zoological preserve. I don't know, I think it was like 250 acres or something. It's just this huge expanse. Kind of drive through, it's as if you're going on safari. You'll have the lions, the hippos, all sorts of African megafauna. And on the grounds of the zoo, there's kind of like an actual zoo in which you can walk through it and not just be in your car. And in one particular corner, there was this wildlife hospital, and so spent, I think it was 4 days a week, maybe it was five some days, kind of just shadowing the vets and working with a lot of birds of prey. Because Israel is kind of on the migration route for a lot of birds flying south from Europe for the winter. And so if something happens, a lot can kind of be stuck on their paths and run into trouble. And so the vets there will take care of them. So we saw Eurasian eagle owls, vultures, snake eagles, all sorts of crazy raptors. Um, and yeah, it was really cool experience. I got taloned by an eagle
Wow.
on the back of my neck. I kind of ducked down to escape probably a worse laceration. But yeah, you got to be careful with some of them. So,
Yeah, they're a lot bigger
but
than you think they are.
oh yeah, for sure. Their wingspan is just insane. But that was an awesome experience, and I, as much as I loved wildlife and working with birds, and sometimes there was mountain gazelles that would get trapped, and we kind of take care of them. They sustain fractures and all sorts of crazy stuff. But I realized that at least for the initial part of my career, I kind of wanted to stick with honing my craft in small animal medicine and stick in the U.S. for now. And so I've just been at a series of small animal hospitals, working with primarily dogs and cats. The periodic Yojik or hedgehog. Yojik is right. My father was from Ukraine originally, so that's how I
Okay.
think of it initially. But periodic hedgehog or rodent, but mostly dogs and cats.
Hedgehogs are very popular now, I'm seeing.
I think pocket pets are on the rise in the U.S. It's just very easy to kind of take care of. They're a little less troublesome than
Right.
dogs and cats.
And they're
Maintenance
disposable,
wise,
so, I mean, we won't talk about that, but
so we'll take away from that.
oh, well, great. That's excellent. So, what we're talking about tonight and what we're going to tell everybody about is the disease of parvo. Now, everybody's heard over the last year of coronavirus, and I know that I remember drawing up coronavirus vaccines back when I was, way back. But we're going to talk about parvovirus this time. Tell us what it is. What do we look for? How does it affect dogs? Does it affect cats? Take it away.
Yeah, thank you. Parvovirus. It is. Let's just start off with this. You don't want your dog to get it. It is why we vaccinate so regularly for it. Um, for people who are on this chat, if you have a puppy, most likely your veterinarian has recommended regular vaccinations until 16 weeks old, and then once yearly afterward. But it's a pretty nasty viral disease that can affect dogs. We can kind of talk about parvo in cats or parvo in humans, but for kind of the general purposes, I think, of this discussion, it's really largely a canine disease. Certain breeds are a little bit more predisposed, like pit bulls, Dobermans, English Springer Spaniels, and German Shepherds. But really any domestic dog or wild can unfortunately suffer from this.
How do they get it?
It's a great question. They often get it from each other.
Mm,
Dogs are very social beings, and in a litter, it's a virus that can be stuck on surfaces and kennels, on toys, on themselves. So it's fecal oral or fecal nasal transmission. So if a dog is, they see their world and they experience it through their, biting things and teething and chewing. And, if they ingest some fecal matter of another dog that was shedding this virus, it's very possible that they could develop symptoms associated with the symptoms associated with the disease. So that's why, well, we can get into kind of like diagnosis and treatment options, but definitely, um, at least in my role as a clinical veterinarian, I see it as my job as kind of educating owners as to um, the importance of prevention, because it's just one of those viruses that can stick out in the environment for a really long time. I don't know if anyone actually knows exactly how long it can survive in the environment, but it's non-enveloped and very heat resistant. Um, so, super high temperature, super cold, it may not kill this virus. And, so it could live out on surfaces or in kennels, really anywhere in the environment for a long time. And so that's why puppies are, as immune compromised as they are before their immune systems kind of fully kick in and they have their kind of maternal antibodies from their mother in their bodies. And as that's kind of waning down and before they get protective immunity, we really need to step in and do regularly every 3 to 4 weeks or so vaccines until around 16 weeks old. And that generally conveys immunity. I think there has been an unfortunate, like I guess, canine public health crisis since the pandemic, where a lot of different states have reported upticks in the number of parvo cases, and I think in large part it might boil down to just the means of communication. I think has been strained in a lot of different systems. I'm working as a clinical vet on site. I, haven't really taken time off since the pandemic, but I know a lot of clinics have unfortunately had to, you know, they couldn't really weather the storm with business closures, and a lot of puppies didn't necessarily, it's not their fault, but owners didn't weren't really able to stick to the schedules that would have been advisable, and it's unfortunately, I think, led to a number of increased cases. Um, but prevention is the key, really. Like the statistics for a dog who um, has parvovirus are around 80% survival rates, which are pretty good. But it usually requires hospitalization and fluids, and that can sometimes take up to 2 weeks for a dog to recover. But yeah, I know I'm jumping around the place, but
No, it's fine. What I
yeah.
find interesting is what I've been saying over the last year when in our own pandemic, how viruses, their job is to replicate themselves and survive
Mhm.
and change, and they find the best way that they can. And the way with parvo, when you talk about it's transferred fecally, they're shedding the virus. Is dogs love to sniff gross stuff, and poop
Yep,
is right up there on the list. And how
absolutely.
parvo gives these dogs such diarrhea that the virus is saying, "Hey, where I'm gonna, this is my best way to spread myself to all these other poor puppies out there." Speaking of diarrhea, what should people look out for? What are some of the symptoms, the signs? What should they look for if they suspect they're, now? Is it mostly puppies, or can adult dogs get it? What can they look for to see if, well, maybe my dog has parvo, I need to call the vet?
Absolutely. So I think really any any young dog, generally speaking, the kind of the demographic that we're looking at is a 6-week old puppy to 6 months. That's kind of the general time frame that I'm kind of looking for. If the patient presents to a young puppy patient presents to me in that time frame, whether it's been vaccinated once or twice or even 3 times or not, if it's been having some vomiting or, as you mentioned, the diarrhea, that's going to be on my differential list without a doubt. And so some of the early warning signs to look for, maybe even before the diarrhea starts, would be just, it's pretty non-specific. So inappetence, why isn't my puppy eating? I've been feeding him the same food, or maybe experimenting, with maybe a gradual transition from one diet to the next, but all of a sudden, he's not eating, or he or she's been a little bit lethargic, not wanting to play as much. So those are kind of some, early warning signs. It may be nothing, but that's kind of what you start to see. So, maybe that will kind of trend into not eating, maybe not drinking, becoming a little dehydrated. If you have a rectal thermometer at home and feel comfortable taking it of your puppy, noticing a little bit of a fever, those could be some early warning signs. Kind of as we progress a little bit later through the progression of the pathogenesis of the disease, there you can have, then you start really to see vomiting, really foul smelling diarrhea. I imagine that in your experience in the hospitals in which you've worked, you've smelled the puppy diarrhea, the Parvo diarrhea.
One of the questions on my list that I was given here was, does Parvo have a smell? And I said emphatically, yes, it does. You know it, I know it. And we would just, some poor puppy would have diarrhea and we would go, oh yeah, that's Parvo. And before we even did the test, we knew it's just that bloody diarrhea.
It's one of those, exactly. It's one of those things, like, before even doing blood work, and, noticing like a low white cell count, there's two specific types of white blood cells that will often go down with Parvo. But before you do that, if you see a puppy and you hear the history from the owner, they're complaining about bloody stool, and they bring you in a carrier and a towel or something, and you smell it, like, you can just diagnose based off of smell, man. I mean, it's almost like pathomnemonic, and that's got to be it.
Absolutely.
And I don't know how to explain like why that is, but it's pretty.
I think it may just be the blood in the stool. I'm not sure. It's something about the, and you see a puppy that's flopped out. It's not being a puppy, and it's not eating. It's got bloody diarrhea. 9 times out of 10, I would say it's.
But even like, I'm thinking of other like hematochezia, where you get blood in the stool, like Giardia. There's something about parvovirus that you can just tell from the smell.
Well, besides the smell, besides the gifts that God gave you, how do you diagnose Parvo in the clinic?
Sure. So there really the two main ways to go about that would be via so like how nowadays, when I don't know if you've gotten COVID tested couple
my
times
wife,
yet.
I have once. My wife, actually, I'm actually getting over it right now.
Oh my gosh.
My wife got diagnosed 2 days after Christmas and had a little bit of a fever. She was sick for about 24 hours. I've been sick for about 2.5 weeks.
Oh my gosh.
But I'm finally lively again and happy. But it was a rough about 10 days of fever and stuff like that. So it's I've had some COVID testing.
I had no idea, Mike. I'm so sorry. My heart goes out to you. I thought maybe just like testing just to make sure, but I'm glad that you're on the up. And
thanks, I appreciate that.
Yeah, unfortunately, like two of my coworkers came down with it in the last 2 weeks, and we're just we're all getting tested and thankfully asymptomatic, and so far all of the other otherwise we've all been negative, but
I wish I was.
So like those tests are kind of like the viral PCR, so they're going to be replicating, and so doing that way, or there's like a fecal antigen test, so just using the stool, and a lot of clinics have the SNAP tests where you can kind of find out an answer within a couple minutes, really. And really, those are like the two ways of diagnosis. That being said, once you determine that, why is my puppy having these symptoms, and we have a definitive diagnosis, additional diagnostics are still very important, and I would highly recommend baseline blood work, like doing the complete blood count and chemistry profile, because we're specifically wanting to look at these. There's usually a pretty moderate to severe leukopenia. So leukocytes are the white blood cells that are, going all around our bloodstream. And what parvovirus does is it attacks with ferocity these, rapidly dividing cells in our body. And so some of those areas include the intestinal lining. And so as it's destroying it's called crypts, CRYPTS, in the intestines, and it causes necrosis and like kind of cell death of those crypts. In vet school, it was like the Bloods versus the Crips, and that's probably a little differently, but we always made fun of that. But when those Crips died, that's where we have all this bleeding, the GI bleed, and the disgusting foul-smelling diarrhea. That's one area, but then it also goes after the bone marrow, and so often you'll see the white blood cell count going down. And so I would definitely advise, for puppies who get diagnosed with it, and they're in the clinic, because I would imagine most vets like myself are going to recommend that the puppy be hospitalized for IV fluid therapy and everything, but you're going to want to find out what is the initial parameter of these white cells. Could there be an anemia or anything else going on? Usually there's electrolyte abnormalities too, just because of all the fluid loss. And so that's something to definitely monitor very importantly over the course of treatment. So that's one of the big things.
So speaking of treatment, I bring my puppy in, drop it off at the curb, spewing diarrhea everywhere, lethargic. You get the test back, it's positive. He's got Parvo. I almost said COVID, that'd be bad. So he's got Parvo. What do you do to treat? How do you guys act in the hospital with it? Is he just sitting in the middle of the room with everybody else, or is he isolated? How does it work?
We usually like bring him. We do the Simba. We show him to every single other pet in the hospital. Yeah,
that's right.
I'm just
but
kidding.
First,
just kidding. Yeah. No one should write that down. That is absolutely the last thing we'll do. As cute as he may be, he is infectious, and that is plain and simple. Like, he presents a threat to other dogs in the hospital, especially those that might be unvaccinated. And so we're definitely not parading him around. We're definitely not holding him for the most part. And if we do, he's going to be in a strict like isolation ward or specific section of the hospital where that is where he is. And to go in and interact with him, you got to be gloved up, gowned up, and then as soon as you do what you need to do, check his parameters, check fluid lines, I can, discuss fluid therapy. You immediately take all that off, that PPE, and then go see your other patients after thoroughly washing your hands and all that. But yeah, I mean, that's just one of the unfortunate things about this virus. You said, it likes to replicate and find other hosts and then replicate in them and wreak havoc. So definitely puppies that are in a litter situation, it's good to kind of get them away from the other ones, just because it's in all likelihood other pets that are around him or her are really susceptible. And so kind of going back to one of the previous points about prevention, I guess, for those pets who are not yet symptomatic, may take some time, a couple days for after a pet has ingested the virus, and it's not going to be immediate symptoms. So the importance of preventing it from happening in the first place, and bleach is your friend in these circumstances. So kind of bleach the bejesus out of the environment from which he or she came, and try to keep all other pets, away from it, and exercising good hygiene anytime. Prior to that, if you have in New York City, we don't really have yards. Down south in New Orleans, I was used to having a backyard, but anytime my dog would go out, that's where she would do her business. But picking up after them, and here it's on the streets, and so everywhere you walk in New York City streets, there's usually feces somewhere, whether it's from the rodents or from from the dogs. You just got to be cognizant of that. So yeah, that's definitely what we do. Isolation for sure, wearing gowns, wearing gloves, not allowing any cross contamination, kind of keeping as everything to a minimum, is kind of the ideal approach to this. And as far as what we do, I'm sorry, what were you going to say, Mike?
No, go ahead.
Oh yeah, and as far as what we're doing, like it's not like just we're keeping the Parvo puppy quarantined, where you're kind of pumping fluids into him or her, and usually, I've never had an owner whose puppy I've diagnosed with Parvo not agree to hospitalization, because we kind of there's a lot of, in preparing for this presentation, I wanted to kind of see, what's out there on the internet, and there is a lot of great resources that I advise and often like give the URL to owners about Parvo, or whatever particular disease Fido may be having, or suspecting to have. But there's a lot of misinformation too, and I was just trying to see what they had out there in terms of the homemade, or the home therapies for Parvo, and nothing, like, to my knowledge, and we definitely didn't learn it in vet school, because to my knowledge, nothing is going to really help that you can do at home. You need to replace those fluid losses. IV fluid therapy, most likely an antiemetic, something like Serenia, is really going to be kind of the mainstays of therapy. But I saw activated charcoal, which can be good for certain pathologies, but really Parvo, it's not gonna cut it. Yeah, really the goal here is gastroprotectants and fluids. Having them hooked up on IV fluids. So
there's always the owner though that says I can do it at home. I know we back a million years ago, we worked with a lot of dog breeders and showers, and things, and they would say, either they would say, we can treat it at home, we know what we're doing, we don't need you, okay, have fun with all your puppies. But we did have an outbreak over the Christmas boarding season, in terms of a client brought in, it may have been about half a dozen German Shepherd puppies. We all had Parvo, and we had to kind of makeshift an isolation area to keep them away from all the other boarding dogs that were there, and nobody else got it except the puppies. But we had to hang plastic and tape off areas and do the Clorox. You mentioned bleach is the best. The little foot bath, you put the towel with the bleach in there, and before you go in and we only had certain people that were allowed to go into the isolation areas. But that was not a fun Christmas boarding with diarrhea.
How many dogs did you have boarded during that? I mean, because I used to work at a band field in Massachusetts, and it was connected. It was like inside a PetSmart, and they had like the pet hotel, is what they called it. And I just remember on New Year's, the winter holidays, it was insane, because sometimes they would come to me for dogs that had stress colitis, and just were, I don't believe it was Parvo. They were older, vaccinated dogs, but who just had stress, and that can lead to some diarrhea. So I would go back there and be runs and runs and runs. The whole place was probably like several hundred dogs,
Hmm.
But I can't imagine 5 German Shepherd puppies coming on Christmas. That's what a story.
Yeah, they brought us a lot of stuff, but yeah, probably our clinic was 100 something probably
Wow.
dogs over the break. We were capacity. I mean, every boarding every holiday from Christmas to after New Year's was in addition to all the normal was just this horrible boarding.
Mhm.
I was very happy to move on to a practice that didn't have boarding. That was
Yes.
boarding is like, let me just practice medicine and not have to scrape
I know,
poop out of kennels and feed dogs 3 times
for
a day.
sure.
So
As was I happy to kind of leave that practice because, like, I'd have my set schedule, all my appointments or surgeries and whatnot. And then on top of that, I would, the manager, God bless her, Kenya, she was awesome. But every time she came in and I was like at my desk or whatever, I knew that that meant at least 2 or 3 additional cases that I would have to go. It was just, another thing on the plate. But
hey, that's all part of it. So
it's part
wanted
of
to
it,
let
yeah.
everybody know we are answering questions. We've got a chat over here I'm watching. If you guys are watching, if you have any questions about Parvo, put them in the chat. We'll read them out and we'll go from there. So we'll just keep on going on. Can your dog give you Parvo as a human being?
So, great question. Thankfully, to our knowledge, no. Now, humans can get parvovirus, but a different subtype. It's not. It's very species specific, and much like cats, we vaccinate them for FVRCP, uh, feline viral rhinotracheitis, and panleukopenia. Um, which is a parvovirus, but it's specific to cats. Much like it is very, very, very unlikely. I'm not going to say entirely impossible because I think there is a case report or two of a cat who has gotten parvo from a dog. I think, for all intents and purposes, this is largely at least the specific subtype of parvovirus, CPV2, which causes all the nasty aforementioned symptoms that we've discussed. That's going to be for dogs. Now, even though humans we can't get it from our pets, we can serve as vectors. So, like, whereas the toys and food or anything in their environment are the fomites, like the inorganic substances that the virus can kind of be on and then spread to other dogs. As a living organism, we're considered vectors that could kind of, if we were petting our dog who, unbeknownst to us, has parvovirus, and we go to our friend's house and maybe not during COVID, but we socially
That's right.
distantly hang out with them in the park or something. We could unwillingly be spreading it to them.
You mentioned the toys. If your dog has parvo, do you recommend getting rid of all his toys? Do you recommend bleaching where you can? We don't want to reinfect him when he comes home or if you give your toy to a different dog.
Yeah, I would advise not to give to another dog. I mean, I guess it depends on the type of toy, and if it's a very easily cleanable one, definitely like bleach it, let it kind of be, and let him come back to it for a while. It's unlikely that he's going to be reinfected by it, just because dogs that, for those who do recover from parvo, around 80% success rate, they likely will have a really long-lasting immunity. So they should be fine, but I do think kind of the best precaution is avoidance. And if you know for a fact that they've been playing it for a while, I think, even though it's an investment to buy a new toy or whatnot, I really think the safest thing is probably getting rid of it and then, buying new toys. Um, yeah, I honestly, like, it can be very expensive to treat. But we have to be cognizant, there's cost of prevention, but I think prevention the costs of that far outweigh the cost of treatment and the detriment, the suffering that a puppy will go through with all the symptoms and through treatment, which isn't always guaranteed to be successful. So definitely, like, I wouldn't play with fire, even if a dog, you thoroughly clean the area and disinfect and, bleach as many surfaces as you can. There's always that possibility it's still there and could potentially be,
Sure.
in the environment or on like a raggedy chew toy or something for months or years. So if another
Right.
dog comes, a few years down the line, I think the best practice is just to get rid of it.
And if they get their dog vaccinated, is that a guarantee they're not going to get parvo? I know there's a series of parvo vaccines. Is that correct?
It's true. Yep. We use like the modified live vaccine in our clinic, and it's like a combination. So distemper, adenovirus, parvo, and para-influenza virus. Um, is it a guarantee that they're not going to get it? Unfortunately, not. And as I mentioned earlier, if a puppy, I usually think of the 6 weeks to 6 months range. Doesn't mean that puppy can't be younger or older, or even a full adult dog. Um, Although I think the likelihood goes down much further statistically. Um, but even if they're kind of like partway through the vaccine schedule, maybe they've received a dose or two. There's, that doesn't mean that they're, immune and they're fully protected. Just like, we get the flu vaccine every year, we could still get it. And puppies can still get parvo. Now, it's possible, even if they finished all their puppy vaccines at 16 weeks old, they can still get parvo. Um, it is unfortunately is possible, and I always stress that to owners, because we have the core vaccines that I always recommend to owners: rabies, distemper. Leptospirosis is not a considered core, but it ought to be, in my opinion. Just with the risk, and dogs like the tendency to lick up your puddles, standing water, and there could be urine from rodents. And especially here in New York City, I'm walking with my wife through the park and we see a rodent every other night. So a rat running right by us that's probably like the size of a cat. I mean, they're huge. So they're around. And
You should work for the New York Tourism Board.
Yeah, I would not be a good
Come see the rats.
city. Come see him. But I recommend it, as do I, rabies and December. But even if they've received their boosters and everything, they're unfortunately still susceptible. And so it's possible that the clinical form of the disease might be attenuated. It might not be as severe. They might not be showing as many symptoms, or if once we get them started on therapy, they might not need, some dogs need like 2 weeks of intense hospitalization, on fluids, antibiotics, antiemetics. Whereas dogs, if they're fully vaccinated and yet they still get parvo, perhaps their clinical response will be faster, and they're not going to be in the hospital as long, potentially. But unfortunately, nothing is perfect. Yeah.
Now, speaking of being in the hospital, and you don't have to answer this if you're not comfortable answering this, but what is a broad estimate of how much it's going to cost somebody to have their dog hospitalized for a couple of weeks with fluids and blood work and treatment and things like that? If you're not comfortable, I'll move on to something else, but we'll talk about the rats.
Yeah, for sure. It's a great question. I'm honestly comfortable to talk about it, because I can tell you I actually don't know. I mean, one of the beauties of the position I'm in is, I love that I can diagnose. I can, use my knowledge, my clinical impression of my patients to kind of find out the histories from the owner, decipher what's going on. Like, I had a dog that came in today. His owner came from Puerto Rico. They were just there for the holidays, I guess, an extended trip. And she tells me every year that he comes back, he gets depressed. He doesn't eat as much, and maybe he's constipated, and maybe there's all sorts of things that when I have, I'm talking to her on the phone because that's our policy. And I'm hearing all this, but the patient in front of me looks 100% a-okay. No, nothing wrong on physical exam. He has a little bit of dental tartar on his teeth, but so do 85% of the canine patients that I see. And he's young and otherwise healthy, great body condition, no fever. He looks awesome for all intents and purposes. So I'm hearing all this stuff from the owner, and I know, is it true? What, like, at the end of the day, like, the most important thing is, I'm advocating for the patient in front of me. And so I have the luxury of letting his owner know, this is what I believe is the case. I never like confront an owner, say like, this is wrong, or like, I don't think he's depressed, or a little bit
Liar.
yeah. But like, this is, we can try to figure out a definitive diagnosis, figure this out, and then go ahead with treatment. And so that's really my job. I know kind of generalized price points of different procedures and diagnostics, and it will definitely vary depending on the type of practice. Whether it's I'm in a small animal private practice. If for patients who are, something crazy is going on that I really don't know, and we've kind of done a lot of testing, and or I'm not at the capacity to really absorb this patient in-house, and it really needs, some specialized surgery or something, I'll refer to, the ER or the specialty hospital. And so, prices there may be different. It's going to vary on region of the country. So there's a lot of different factors that go into play. But for me, like, I'm always going to recommend kind of the gold standard as what I think is best for my patient. And so I know for a puppy who we've diagnosed via the the PCR or the fecal antigen test, we know that the dog is Parvo. I know what the dog needs, and I'm not 100% certain. There's no guarantee that the dog will survive, and I always upfront tell the owner. But I know what we need to do to try to get the dog to the best level that we can, and that's going to require fluid therapy. Get an IV catheter in them, get those fluids going, likely antibiotics, and some antiemetic, and prevention of vomiting. And so throughout the stay, if you're going toward 2 weeks, we can get into the thousands, I would imagine, for US dollars. If a dog shows really incredible improvement within several days, and the blood work has improved and clinical signs have improved and abdominal pain has like kind of vanished, then it's possible the dog will be discharged within 4 or 5 days, which I would say the early end of things. And I think you're still kind of, it would be worthwhile to let an owner know kind of the ballpark, and the very least, I would imagine in our clinic somewhere in the low thousands, if I had to imagine.
Get that pet insurance.
Yeah, pet insurance is huge, and I think even though I can't speak for specific companies, and I would say maybe less than 5% of my patients have owners who opt for health insurance. I think it's much more of a thing in Scandinavia. At least that's what we learned in vet school. But here in the U.S., I think it's catching on, but slowly but surely, I hope. But yeah, I mean, if it's a couple days, I may feel comfortable discharging a puppy with it, but I will continue to recommend isolation, because even after a dog has improved clinically and back to eating, back not vomiting at all, and just kind of back to his or her old self, per the owner, he or she is likely still shedding the virus for maybe even more, a week or so, or longer. So it's until we can kind of know for a fact that he or she comes back negative, I would advise, definitely not to be around other dogs. But I think if a dog's improving vastly, with the supportive care. You know, I think, you know, it's really clinician dependent, but I think, you know, a lot of us might feel comfortable with discharging.
So when the puppy comes home, in addition to kind of isolating it for a little while when you get home, what other home treatments would you recommend post coming home with Parvo? Or once they're
Um,
out of the woods with the treatments, they come home. Is there something you recommend that they give the dogs when they get home, or certain?
Definitely just, you know, tender love and kindness, you know, obviously a lot of love, just, you know, um, spending a lot of time with the dog. I think one of the best ways we can show our love to our pets is, yeah, feeding them adequate nutrition. And some of those things can consist of, you know, a really good quality diet, low fat, highly digestible. Um, some owners like to do like the boiled chicken and rice
Mhm.
means, and that's totally fine for some period of time. After a while, most vets, are definitely myself, will recommend getting on one of the diets that's, you know, AFCO approved, or the American Association of Feed Control Officers. You know, they will there's a, you know, a regulatory body that kind of oversees, you know, all these different brands: Purina, Royal Canin, Hills, Eukanuba, Iams, all that jazz. You know, the pet food market is, it's huge. You know,
Mm.
every other day I'm finding out about a new brand, you know, some high end chic boutique diet that an owner says, oh, you know, it's grain free. Oh, it's like whatever. And then I have to kind of caution them, well, grain free diets are actually correlated with heart disease in dogs. And there's, you know, there is scientific evidence that would suggest maybe we should rethink that, or we should rethink raw, which is, you know, one of my pet peeves. You know, an owner will come to me with their dog and complain that, you know, he's been, you know, having diarrhea for the last 3 days, and we switched him to this, you know, really, you know, name brand new diet, and it's, you know, freeze dried raw. And I, you know, I have to let them know that, you know, these are all kind of buzzwords that are big in the field, but unfortunately might not be the best for your pet. And so I
Yeah,
guess
we
when
would have people bring Ziploc bags in with like turkey necks in them and like raw ground beef, and this is
yeah,
what you're feeding my dog, and we would say,
yeah,
yeah, yeah, okay.
yeah, yeah, I get raw rabbit chews here. I get, you know, crazy things. And I, you know, I laugh in my head, but I also, like, some owners don't know, and some owners might be, you know, seeing a lot of stuff on the internet from sites that have great marketing, but those companies might not, at least in their, you know, um, business growth, yet have the research and development to kind of back up scientifically the food that they're putting out. So I think for a short term, something that's really highly digestible, you know, just, you know, your one protein, you know, the chicken and rice, like that could be really good. But kind of eventually, you know, a gradual transition to you know, regular puppy food, and around 1 year, you know, depending on how old they are, to their typical diet. Um,
What about probiotics?
yeah. So probiotics are huge. I think one of the things that we, I guess, haven't touched upon yet so much, was um, the risk with this viral disease that we've been talking about for all this time, with the possibility of secondary bacterial infection. And so that's just one of the things, like, you know, owners might be like, oh, well, why? You know, I get the fluids, you know, we need to correct these, you know, fluid deficits, and, you know, all these electrolyte abnormalities that are going on. I get that, but, you know, is my dog getting all these antibiotics? And so, you know, the importance to underscore here is that, you know, even though we don't really use antivirals with this particular disease, there's so much risk for bacterial translocation in the gut, to kind of take over the intestines and just worsen the disease. And that's probably in large part, you know, why you get that just malodorous diarrhea. And so we, you know, broad spectrum antibiotics are, you know, like ampicillin, or huge when it comes to treatment of parvo. And anytime, no drug is benign. So antibiotics, as wonderful as they are, and as a big of a proponent as I am of using them, they can also, lead to worsening of symptoms potentially. That being said, I think it's important to use them here. Um, but probiotics are something that can be daily given to a pet to kind of help with that gut microflora, reestablish kind of the balance of good bacteria in the intestines, and it's something that I also will often recommend, not just for parvovirus, but really for a plethora of intestinal diseases.
Well, I want to let our audience know that if you go to rockwellpetspro.com and use the code PARVO, PARVO, you get $10 off any natural dog probiotics. So that works out pretty well for everybody who's wanting to get their dogs on the probiotic train.
There you go.
Well, any other things you want to talk about with Parvo? Any we're here to educate people. We're here to talk about what can I give my dog Gatorade at home for Parvo, or can I what can I do? There's just something that maybe people don't know, or something that people would come in and ask you would hear it a lot and say, okay, this is where the misinformation is, or a lot of people come in and ask you the wrong thing. Can I do X, Y, and Z? And you go, all right, let me go into my spiel about,
Right.
is there anything like that you'd like to throw in?
Sure. Let's see. I see. So some of these questions here were late effects of parvo. Can parvo cause hairlessness?
Right.
Can a dog get parvo twice? A lot. These are great questions. I guess jumping to the first one about late effects of parvo. I didn't know because I'm not familiar with that. It's not something that I learned about in vet school or that I've really seen over the course of my clinical practice. I checked a study online, long-term effects of canine parvo infection in dogs, published in 2018, because I just didn't know. And so that's one of the beauty of our profession is that there's so much that is still yet to be known, and so that's the beauty of research. And even though that's not necessarily my field of expertise, I can rely on looking at these studies and looking up stuff that I just don't know. So evidence-based medicine is huge. And really what I saw in this, they surveyed, I don't know how many dogs they looked at, 67 dogs. A lot of what the owners reported were some chronic intestinal issues. Was kind of like the major one. Skin diseases really didn't, or like pruritus or hairlessness was not something that was thought to be, super, or at least reported by owners whose dogs were previously diagnosed with parvo. Was not something that was really mentioned, but some kind of, there is, at least in a certain subset of the population of these owners who were surveyed, does seem to be some sort of potential correlation with dogs that have, whether it's, an immune mediated inflammatory bowel disease or something like that, or food allergy, where like kind of they're responsive to a change in diet. That seems to be potentially something that could be a long-term effect. But generally speaking, what I tell owners is that if a dog will survive parvovirus, he or she is not likely to have any severe, long-lasting, like long-term effects. So that's a very good thing. If you survive it, you likely will come out of it with great immunity. And hairlessness is not something that that's not even on my radar as to something to be worried there might be some hairlessness if we shave their, shave them to get like a little IV catheter,
Yeah. I was
stuck in
thinking
there.
like a sanitary cut, but yeah.
What's that?
I was thinking like a sanitary cut.
Yeah,
How common
yeah.
is parvo? Like, how many cases would you guys see in a year on average?
Can you repeat that, Mike? I'm so sorry.
How many cases would you normally see in a year of parvo? How common is it?
Um, I don't know if I can answer that. I can say in the clinic that I've been at in New York, um, I personally have not seen a case of parvo. I think we're really good at our vaccine protocol, and we kind of are really strict by that. We follow the guidelines, and owners, generally speaking, are really good at compliance. Um, I'm sure it varies by different jurisdiction and different parts of the country, but I'm knock on wood, and watch next week. Unfortunately, we'll get like a case
That's
load,
right.
but yeah, I mean, I would say like in vet school we saw a lot more cases, and down south, like when I was practicing in New Orleans, where that's where I was first practicing, when I graduated vet school. um, we saw a lot of parvo, we saw a lot of heartworm, um, and I think it's one of those things where prevention, it just isn't taken as seriously, or it's not. I think there's all sorts of factors, um, and there's hella mosquitoes. Forgive me for usage of hella, but just so many mosquitoes down there, and that's the vector that's going to be transmitting heartworm to dogs. And so dogs that aren't on heartworm prevention, or dogs who, just out of the lack of knowledge, owners or whomever may not, bring their puppies in for vaccines. And so I think the caseload down there was just a lot higher. But I think I've been blessed, at least in the Northeast, to not see as much cases, knock on wood. So, um, yeah.
Yeah,
But that's really. I'm sorry. What was that?
we got wicked mosquitoes down here.
Wicked mosquitoes. Yeah.
Well, once again,
Um,
go to rockwellpetspro.com and use the code PARVO and get $10 off natural dog probiotics. So before we wrap this thing up, I want to thank you, Dr. Bax, for your time. Is there one last kind of overarching thing you want to leave people with when they think of parvo? I don't want to say when they think of parvo, they think of you, but when they think of parvo, what's the one kind of lesson that you wanted to, the last impression you wanted to leave people?
um, when you think of parvo, think of vaccinating, because this is a largely preventable disease. It's going to be out there. It's going to be out in the environment, but only you can prevent parvovirus. You have such an important role in your dog's life, and especially at that time of, their immune system is not fully up to snuff, and you're embracing that bond, bringing your new puppy or your rescue dog home, however your dog came into your life. um, you can advocate for them, and by bringing them to vets like me, and we can kind of help you determine what is the best thing to help your dog stay safe from parvo. And prevention via immunization is spot on.
Excellent. Awesome. Well, thank you, Dr. Max. It's great to see you. And I think we're going to wrap this thing up here. We've been at it almost an hour. And hope you guys have a great week. Stay safe out there. And we'll talk to you later.
All right, Mike. Take care. Thank you so much.
Thanks.
Take care.
I'm not sure how to stop this thing.